A hearing examiner recommends suspending a Medina surgeon's license after a patient died during a routine tooth extraction.
Now that prominent surgeon's fate lies with the state dental board. 19 investigator Mike Mason first broke this story, now has the latest.
He was the guy in the Santa outfit handing out candy canes to the little kids.
Brandy Miller remembers her late husband as a big, strong man and a great dad who loved his kids fiercely. That's how she described Matthew during a deposition in her lawsuit against Dr. Faisal Qureshi. This is video of his deposition from last year.
Would you have done anything differently in this case in hindsight?
No.
In August of 2023, the 48-year-old man died during surgery to remove 3 of his teeth. Qureshi performed the surgery at his practice, the Visage Surgical Institute in Medina. The lawsuit states just moments after Qureshi gave Miller anesthesia, he stopped breathing. Miller then had a heart attack and died at the hospital 4 days later.
He's more than just a father of 3 and a husband.
Attorney Michael Pasternak represents Brandy Miller. In 2024, he filed a wrongful death lawsuit against Qureshi. The state dental board investigated, and in 2025, it notified Qureshi it planned to suspend or revoke his license. At a hearing last fall, both sides presented arguments. The board alleged Qureshi should have required a physician's clearance prior to surgery, especially since Miller was morbidly obese.
And nothing in his evaluation with me made me believe that he would be at a higher risk for anesthesia in my office.
He had every risk factor that you could imagine walking in terms of giving general anesthesia.
The state found Miller reported weighing 315 pounds when he actually weighed 355, making him super morbidly obese. The board said that alone would astronomically increase the risk of airway issues or concerns with anesthesia. The examiner found the state proved that Qureshi failed to conduct a full medical evaluation and that he failed to adequately monitor Miller while under anesthesia.
If you don't have someone watching the monitors and the person starts decompensating, meaning they're not breathing right, this is the very thing that will happen. That's why you have to have a trained observer. He did not have one.
The board alleged Qureshi changed Miller's anesthesia records after surgery or let someone else do it. But the hearing examiner said it did not appear that he changed the records in order to deceive anyone. In conclusion, she felt what happened to Miller was an isolated failure. She recommended the following: suspend Qureshi's license to administer anesthesia for 6 months to a year, followed by 2 years of probation. The civil lawsuit is still ongoing. It's important to note Qureshi has not been charged with a crime. His attorney declined to comment since this case is still pending. The board will review the hearing examiner's recommendation when it meets again in March. We'll of course stay on top of this and keep you updated. Mike Mason, 19 News.